Hey everyone, welcome to the weekly forum conducted by Brent and all the directors. We're missing you guys and ladies, but we're making progress. We're beginning to open back up. And I want to thank each of you for your sincere cooperation and support. Brent's feeding us well and he's keeping us healthy, and you're doing your part by doing all the little things that need done to make this move on and be a continuing success. So thanks to each one of you, and welcome to the forum. And with that, I'll turn it over to Brent.
Good morning, everybody, and welcome to our weekly forum. Today is Friday, the 12th of June, and we're glad you're able to join us. One of the things I thought we'd do today is try to give you an overall global perspective of where exactly we are. I know that the communication changes day by day as we progress through the reopening here at Regency Oaks and across the nation for that matter. So what we're going to do today is take a look at each and every department, give you an update, tell you where we have been, where we are going, and what we think the future is going to hold. Let's start by looking at the board. This is our Opening Up America plan. Again, as you know, this is designed to be done in phases, 3 separate phases with baby steps in between. Where we are today, we are in phase 1, and our subcategory is recovery stage 11. So we've already gone through the first 10 stages of the phase 1 process. And here's the criteria that we're evaluating in order to move forward. And let's just go through it line item by line item and see where we are. We're following the state governmental restrictions, whether that's coming from CDC or the Centers for Medicare Studies. We're following it day by day and looking at those restrictions. In order to move forward, the death peak date by state, you must have reached it and then have 14 days of either decline or stagnant numbers. We had met that earlier in the month of May, but that now has reversed itself and it's beginning to turn upward. We've not yet exceeded the peak, which happened back in early May, late April, so we're still in compliance there. The state COVID death rate is less than benchmark. That is still true for Florida. The COVID-19 county case rate is less than benchmark. That also is true for Pinellas County. The downward trajectory of documented cases within a rolling 14-day period, we are not meeting this criteria. This number is increasing, and that is one of the things preventing us from moving to the next stage. The staging continues on this second slide. You must have 0 active and pending resident cases in all levels of care for the last 7 days. We are meeting that standard. You must have no new associate cases in the past 14 days. We are meeting that standard as well. You must have a declining new and percent of positive cases in the county or adjacent county or metropolitan statistical area for 7 days. So we are not meeting the standard for Pinellas County. Pasco County is meeting that standard. Hillsborough County is not meeting that standard. So unfortunately, because either Pinellas as a standalone county or part of a metropolitan statistical area is not at that standard for declining cases for 7 consecutive days. When we talk about specific guidelines for individuals, we are in phase 1. All of the residents at Regency Oaks, because of their age and the fact that they may have pre-existing conditions, are considered vulnerable individuals, and the state is recommending that you still continue to shelter in place. It's really important that precautions should be taken to isolate from other individuals who may be showing symptoms of the virus. All individuals, when in public, this is outdoor areas, should maintain good social distancing, not congregate in groups of more than 10 people, and appropriate distancing, when practical, should be applied. Avoid all socialization in groups of more than 10 people. So large group activities should be avoided at this time, as well as all non-essential travel should be eliminated. Okay, those are the general guidelines that we're following and that are helping to drive our decision making. We're going to turn now to the individual departments. We're going to start with Ricky, who's going to update our food and beverage effort.
Good morning, Ricky Baca, just reporting on Phase 1. To report on Phase 1, the sit-down venues and bars remain closed. The grab-and-go without seating is open with social distancing and masks, limited to 1 to 3 residents, no self-service areas, and we will continue with the grab and go from the tavern and also the grab and go in the breezeway. With Phase 1, we will continue to do our meal deliveries. That will change effective this Sunday when we start doing the meal delivery from 4 to 5. The tavern will be open for grab and go from 11 to 1, and then the breezeway also changed from 2 to 4. You'll be seeing a flyer on that, and you will also notice it on the menu. Michael will be continuing delivering his wine, sodas, and beer on Fridays and Saturdays. And food pickups are available by reservation and with social distancing with masks. He is available from 11 to 1 as a grab and go on the tavern, and I'd also like to introduce Amy from
Morning.
marketing.
I'm Amy Waugh, Director of Sales and Marketing.
So we are still currently in Phase 1 of our reopening plan. As we've been doing, we're continuing to do virtual visits and video messaging to our prospects at their home, sending it to them via email. We are also doing home drops, but still socially distancing at people's houses.
Okay, stop.
We are still not doing any group tours or anything at the community. If we do have someone that is a very hot prospect that we've done all of our other communication with via virtual tours, and they are ready to make a decision or have deposited and need to see the apartment, we will do that on a one-off basis, but that will be following all of the CDC and community guidelines and protocols. For our Phase 1 of our marketing events for our prospects, we are actually still not doing any of our on-site or off-site, for that matter, marketing events. We are doing home drops. We've been doing home drops with our prospects since all of these new processes started. When we do home drops with our prospects, we do follow all state and local guidelines. We make sure that we do not go into their home. We stay outside, we leave the information or whatever it is that we're dropping off to them to make sure that we're doing home drops safely. We do have a marketing event, our first on-site, some type of regular event coming up on June 25th. It is a drive-by tour event. Some of you have been contacted about that. It is actually going to allow us to have prospects come onto the campus but not get out of their car so that they can safely social distance, and we can follow all community and CDC guidelines, and we're hoping for that to be a great event. And again, that's on June 25th. If you have any questions, you're welcome to contact me. For our Phase 1 of our marketing events for our prospects, we are actually still not doing any of our on-site or off-site, for that matter, marketing events. We are doing home drops. We've been doing home drops with our prospects since all of these new processes started. When we do home drops with our prospects, we do follow all state and local guidelines. We make sure that we do not go into their home. We stay outside, we leave the information or whatever it is that we're dropping off to them to make sure that we're doing home drops safely. We do have a marketing event, our first on-site, some type of regular event coming up on June 25th. It is a drive-by tour event. Some of you have been contacted about that. It is actually going to allow us to have prospects come onto the campus but not get out of their car so that they can safely social distance, and we can follow all community and CDC guidelines, and we're hoping for that to be a great event. And again, that's on June 25th. If you have any questions, you're welcome to contact me. For our Phase 1 of our marketing events for our prospects, We are actually still not doing any of our on-site or off-site, for that matter, marketing events. We are doing home drops. We've been doing home drops with our prospects since all of these new processes started. When we do home drops with our prospects, we do follow all state and local guidelines. We make sure that we do not go into their home. We stay outside, we leave the information or whatever it is that we're dropping off to them to make sure that we're doing home drops safely. We do have a marketing event, our first on-site, some type of regular event coming up on June 25th. It is a drive-by tour event. Some of you have been contacted about that. It is actually going to allow us to have prospects come onto the campus but not get out of their cars so that they can safely social distance, and we can follow all community and CDC guidelines, and we're hoping for that to be a great event. And again, that's on June 25th. If you have any questions, you're welcome to contact me. We are still in phase one also for resident move-ins, for people moving into and this is talking about just the independent living. We have people that have deposited on apartments, they've put their home on the market, they've sold their home, and therefore they have nowhere else to go. So they need to go ahead and move into the community and occupy their apartment. We make sure when they do that, they know that there is a 14-day quarantine that they will be under, and that there may be protocols of the community we want them to follow to ensure that they move in safely, not only for themselves, but for all of the residents and staff at the community.
Now I'd like to introduce Leslie Haas, the Resident Services Director.
Hello, I'm Leslie and I'm here to talk about visitors on independent living.
So for phase one, currently in independent living, we are allowing a maximum of 3 visitors on the exterior of our campus. This means you can meet with them along the boulevard, on a bench while social distancing, or under the porte-cochere of the north and south front. So for phase one, currently in independent living, we are allowing a maximum of 3 visitors on the exterior of our campus. This means you can meet with them along the boulevard, on a bench while social distancing, or under the porte-cochere of the north and south front entrances. They are not allowed to enter the building, to go to the lobby, or meet with you on the breezeway. That is our interior outside. So again, only a maximum of 3 people for the visit on the exterior of our campus. Thank you. For healthcare providers, we are not allowing any podiatrists, audiologists, dentists, massage therapists on our campus, but they are allowed to be on campus to visit and perform in the Wellness Center, Norfolk 106, wearing the proper personal protective equipment. We are only allowing healthcare providers in residence apartment that are credentialed and have gone through the screening process at the front desk to see residents in their apartment for personal care.
And now Tiffany Rivers, Community Life Director.
Good morning, Regency Oaks. Tiffany Rivers, your Program Director, and I'll be going over the community life during phase one. So during phase one, you've noticed this week that we allow internal activities for groups of 10 or less, which includes Zelko, all of his activities that has been taking place in the gym, as well as his group fitness. We are asking residents and staff to wear masks in the independent living. External visitors are not allowed at this point. Only person that we're allowing on campus is Peggy for her exercise class. And we're also excited for next week for our resident-led group activities. On campus, we're actually allowing the maximum of 15 people in those groups. All of our resident leaders have been contacted and made aware of the social distance and mask requirement in those group activities. As we continue with phase one, residents may use the common and outdoor spaces with limitations. That includes our breezeway and our alfresco dining. We are asking that the groups are at max 6 people, and we're limiting the capacity to 50%. This portion of the phase one introduces the concept of our transportation and the residents' need to get to medical appointments like off-campus pharmacy, physicians, medical, dental, as well as our grocery shopping. We are asking that if you go grocery shopping or you need the assistance from transportation, that it is scheduled, but we are still providing that service to our residents. We do want to emphasize that a self-quarantine is not required upon a return for a medical appointment, but if you are entering the hospital setting, we are requiring you to do a 14-day quarantine. On this portion, we'll be emphasizing off-campus visits or even if you meet for dinner with a family member. Currently, we are still highly discouraging that type of behavior, but in the case that you do, please understand that we will require a 6-day quarantine. For any of our residents that are dog walking or outside stretching their legs, please remember to check in at the front desk to get your temperature screen. That allows us to have a baseline for your temperature. We also would like to emphasize that all of our residents should be checking in at the front desk to have their temperature checked at least once per day. This procedure allows us to have a baseline for everyone's temperature. So if you would like, you can always call the front desk and see how many people are at the desk so that you can be as social distance as possible. Currently in the fitness center, we do have sign-ups at the front desk that you're able to sign up for a time slot. We are asking that you social distance and wear your mask in the gym as well. We do have regular staff cleaning of the gym twice per day, one midday and one in the afternoon. Once the pool area is open, you probably notice all the construction and how wonderful it looks. The hot tub will still be closed, and once the pool is open, and that will be phase 2. During phase 1, all community group transportation, including grocery shopping in the bank runs. During phase 1, all community group transportation, including our grocery shopping in the bank runs we used to do, is still closed at this point. And now a few updates from Sherry and Christine from Innovative Home Services.
Good morning. I wanted to bring to your attention that some of you may be receiving your stimulus payment via a Visa debit card. Please note that this comes in a plain envelope and it's marked from the Money Network Card Held Services on MetaBank. It does not state that it's coming from the Treasury Department. So if you receive that card, your funds can be transferred to your bank account. However, you do need to go to the bank. They will transfer the funds to your account and there should be no fees. Again, there should be no fees. If you feel that you've received this Visa debit card, it's a blue and white card, it's blue with white stars, and you feel that you've thrown it away, you can call for a replacement card. That phone number is 1-800-240-8100, option 2. If you have any questions or concerns, please don't hesitate to call me and I'll be glad to help you getting a replacement card. Thank you.
I'm Christine from Innovative Home Services. I just wanted to let all the residents here at Regency Oaks be aware that we have officially changed our name from Personalized Living to Innovative Home Services. All of our services that we offer remain the same. We are still in N105 and our phone numbers have also been retained. Extension 503 and 502. Have a great weekend.
Hello everyone, Jesse Rosalie, your EVS Director. We will discuss our portion of phase 1. We have modified our housekeeping service. The goal is to reduce the time in the apartment from normal. For example, bed linens, changes, clean resident bathrooms and kitchen. That's something that we are doing on a weekly basis. If you notice, we have been focusing on different areas of your apartment on a weekly basis. So bear with us as we continue to communicate this on a weekly basis on Mondays. Channel 732, you can also find it in the Oaks as well. If you of course have any questions, you can always contact me at extension 508. We encourage residents to leave their apartment at all times while the housekeeper is in there, and if you can remain in a different room, we prefer that, or if you could just take a walk in the meantime during that time of service, we appreciate that as well. We continue enhanced cleaning in all common areas. We're doing this every morning and also in the afternoon as soon as the housekeeping team finishes with the residents' apartments. Residents' masks are required, and staff must wear masks and gloves at all times. If you notice, we practice this very well in the housekeeping department, and we will appreciate if you do the same as far as mask is concerned. Housekeeping continues. That's it.
Lauren Rose, Director of Administrative Services, and I have an update for you on the front desk procedures. We are continuing to accept deliveries from newspapers, packages, UPS, Amazon, Federal Express. Just want to take this opportunity to remind you, if you do receive packages, even groceries, that you should, once you have them in the apartment, remove them from their original containers, discard the boxes that they came in, and sanitize the contents, either using a disinfectant wipe, or you can spray your packages just to make sure that you're not coming into anything contacted with the virus. Now, Darwin Perez, our maintenance director, will tell you about protocols in his department.
On the work order parts, we only do an exception work orders. We only do an HVAC, electrical, and plumbing, and emergency work orders.
Good morning, everyone. My name is Darwin Perez with Plants Operations, and I'm gonna talk about our opening our phase.
On the essential vendors, we are allowing the vendors to come in doing social distancing and wearing the proper. Our vendors, we are allowing them on campus, just making sure they're using all the PPE, essential masks, and keeping the social distancing. A quick update on Monday the 15th and the 16th, the contractors will be removing the oak tree on the north entrance. So the north entrance will be closed from 8 to 5 on those 2 days. A quick update on Monday the 15th and the 16th, the contractor is going to be working on removing the oak tree on the main entrance. The main entrance will be closed from 8 a.m. to 5 p.m. on those 2 days.
Now to end our presentation, Leslie will go over the last slides.
We are continuing to do prospect assessments for our new move-ins, and we still recommend residents continue to wear face masks in all of our common areas at Regency Oaks. If you are in need of a face mask, please see me in Norfolk 108. Thank you.
Great show, extremely interesting. I want you all to know that your board is also moving forward as we begin to come out of this COVID-19 virus show that we're in. We're going to televise our board meeting to you on next Wednesday. We're beginning to have executive luncheons also. And so we're beginning to all come out of this, and I ask for your patience, and I ask that we continue to all cooperate and as a team move forward and keep ourselves healthy and safe. Thank you all very much.
Okay, thank you very much for joining us today. I hope you found the information informative and useful. We had so much information to communicate and share with you that we weren't able to look at the other side of the coin. And that's what we're doing with our associates to make sure they keep you safe and that they themselves are safe. So we're going to be back Monday for our COVID show, and we're going to be featuring Sandra Novatko, our Director of Human Resources, with that update. So have a wonderful weekend, and we'll see you again on Monday.